According to Google, there is currently no cure for hemiplegic migraine. Even though I have completely cured my hemiplegic migraines by going onto the lion diet. I'm someone who suffered from hemiplegic migraines for over a decade, went onto the lion diet, and now haven't had a hemiplegic migraine in over a year. This is no coincidence, this is no lucky break, this is the longest period I have been in my life without experiencing a hemiplegic migraine. It is a direct result of going onto the lion diet. So, if that isn't enough to make you consider whether diet is causing hemiplegic migraines for you, and you have decided that you want to rely on these medical institutes to make your decisions for you and ignore someone with real lived human experience and instead hand over all of your thinking to these people, I figured what we would do is have a look through some of the different medications that are recommended to people who suffer from hemiplegic migraines and look at some of the side effects, not to put you off of them necessarily, but just so you know what you're getting yourself into. So let's go through. So we have this article right here, Hemiplegic Migraine Symptoms, Treatments and Advice. Let's have a look first of all if the word diet is mentioned on this page. No, it's not, which is interesting, isn't it? Because it's supposed to be advice, treatments. I'm a real human that suffered from hemiplegic migraines and that was what caused it for me. Looks like they've accidentally not included that, or maybe they just don't know about it. Maybe this is all the information that they have and they're just not very well researched. migrainedisorders.org doesn't know about this. Okay, so let's have a look at this first one right here, and we will have a look at the side effects. Confusion, headache, ringing in the ears, changes in vision, tiredness, drowsiness, dizziness and rashes. I'd rather not have any of those things if I can help it. When I had hemiplegic migraines, I had enough that I was dealing with. I wouldn't have also wanted these things, but to be fair, confusion, headache, changes in vision, tiredness, drowsiness, dizziness, they were all symptoms of hemiplegic migraine for me. So if I was taking this, I wouldn't have known whether it was the hemiplegic migraine causing these things or whether it was the pill causing these things. And when I start to feel better, I wouldn't know whether it was my body is recovering from it or whether these pills are helping me. I wouldn't know. But I would probably assume it was the pill helping me because that's what people like these at the NHS would be telling you. Ibuprofen, this is one that I took for a couple of years and it done absolutely nothing. Headaches, dizziness, nausea, vomiting and indigestion. Again, many of the symptoms that you experience when you are suffering from hemiplegic migraines. Let's have a look at this. So we've got burning, crawling, itching, numbness, prickling, pins and needles or tingling feelings. This is all symptoms of the hemiplegic migraine. Doesn't sound very good if it causes the symptoms we're trying to mask, does it? Because there's no claim in any of this that this is going to fix the root cause of your problem. This is all about masking your symptoms, not fixing the problem with your body that's causing it. And so if it's causing this, it doesn't sound very good when we've already got this going on. I mean, this was a direct signal. Your body was telling you there's something wrong. You need to change something. Something's going wrong. That's why you're feeling all of this. There's an issue with your body. And now you're going to take this and it's going to cause this. I wonder if that's because your body would be trying to tell you that maybe it doesn't want this. I don't know. I'm not a doctor. I don't have a medical degree, but that's just where my mind goes. I wonder if you agree, or whether you think these symptoms, these side effects of taking this, maybe you think that's a good thing, that your body likes it and that's why it's experiencing it. Same with chest pain. I mean, to me, if my chest was in pain, I'd be very concerned about that because normally my chest don't hurt for no reason. I don't normally get chest pain, and when people do, it's often because there's something seriously wrong with their body. So if I was taking something and it was causing this, I'd be very concerned. I would also be very concerned if I was getting discharge from my eyes after taking something, because normally my eyes will only water when I've got dirt or dust in them, because my eye doesn't want that dirt or dust in it. And so it will try and get rid of it. Now, if I was taking something, some pill, and it was causing that, I'd be very concerned by that. Same with the eye irritation. You know, sometimes I've got like shower gel in my eye and it's gone really red and it's been like itchy and I've been rubbing it a lot trying to get it out. That's normally not when I've got something in my eye that wants to be there. Fast, irregular pounding or racing of heartbeat or pulse. Well, for me, whenever I've experienced racing heartbeat, it's been when my body has been in a state of fight or flight, or when I've been doing something that took a lot of physical exertion, exercising. If I was just sitting down and I experienced a fast, irregular pounding or racing heartbeat after consuming something, I'd be very concerned as to why my body was reacting in that way. Are you getting the point I'm making? Itching, redness or swelling of the skin. Normally, my skin will do that if it comes in contact with something that it doesn't like, and it does that to try to get rid of it. Neck pain. I experienced a lot of neck pain when I used to suffer from hemiplegic migraines. I would hate to take something that would make it worse, because my neck wasn't hurting randomly. My body wasn't randomly sending these signals of pain for no reason. My neck was in a compromised position. Redness of the inner lining of the eyelid. Never had that, but don't sound very good, does it? Not something the body normally does when it's being helped by something. What have we got with this? So we've got weakness, tiredness, upset stomach, heartburn, dizziness, drowsiness, headache, dry mouth. Doesn't sound like that's helping me improve my health very much. This one's got dizziness, headache, dry mouth, indigestion, drowsiness, excessive tiredness, flushing, hot or cold feeling. Well, normally when I've had the hot and cold feeling, that's when I've had the flu and my body is trying to fight off this virus, this flu in my body. My body's trying to fight it off because it doesn't want it there anymore. I wonder why taking a medication that's designed to try to help improve my health my body would react to it in that way. It doesn't sound very good, does it? But as I say, I'm not a doctor. Maybe this is all helping. And maybe your body is just dumb. Tightness, pain, pressure, heaviness in the chest, throat, neck or jaw. I wouldn't want to experience that while I was experiencing a hemiplegic migraine. Here we've got more rapid pounding and irregular heartbeat. Shortness of breath. That's normally when you have heart problems, isn't it? Shortness of breath. Why would your body react in that way to something that's there to help you? Breaking out in a cold sweat. This is again a symptom of the flu. It's the only time I've ever had that. Lightheadedness, another symptom of the migraine. Dry mouth, hot flashes, lack or loss of strength, nausea and vomiting, sleeplessness or unusual drowsiness. I had enough problems with hemiplegic migraines, thank you. I just wanted to solve the root cause, but apparently there is currently no cure for hemiplegic migraine. Let's have a look at hemiplegic migraine root cause. Combination of genetic and environmental factors. Overactive nerve cells. Nothing to do with diet whatsoever. Feeling or being sick. Feeling dizzy, unsteady on your feet or tired. Feeling hot or cold, face flushes. Irritation or burning in your nose or throat after using the nasal spray. Nosebleeds after using the nasal spray. Doesn't sound like it's very good for your nose if it's making it bleed. Bad taste in your mouth. Chest pain, severe. Severe chest pain. My body doesn't normally hurt unless I've done something to hurt it. I've never randomly just had extreme pain in my chest or in my hand or in my face, unless something's happened. If I've hit my hand on a door or something, then it's usually hurt. I've never had it randomly start after taking something that's good for me. Heaviness, tightness or pressure in the chest or neck. But I'm sure these are all things that we don't need to worry about. I'm sure there's been studies that show that even if you experience heaviness, tightness or pressure in the chest and neck, that it's totally safe. And I'm sure that we can't question that, because these geniuses who haven't realised that diet is the cause of hemiplegic migraines, they've not told us, so must not be true, I guess, because we can't question these guys. They've got an official looking website. You can translate it into Spanish and everything, look, and they're on social media. You can even donate to them to help them get the message out there that there's nothing that they can do to help. What else have we got here? So we've got some devices. These things will obviously not cure the root cause. Let's have a look at it. Something you stick on your arm. Looks all very complicated, doesn't it? But apparently it's going to fix your hemiplegic migraine. Your body is having a reaction to something. It clearly doesn't like something that's going on in your life. You're going to stick this thing on your arm and apparently it's going to fix it all. Let's have a look at this. Ketamine. This isn't really laid out very well, but let's see here. Dizziness, nausea. You might also need some anti-nausea drugs as well. Who knows what they're going to do to you. Because normally I don't feel sick unless my body wants to get rid of something in my stomach. There's something it don't want there anymore. Normally that's when I start to feel sick, like if I've eaten food that was off or something. Like, you know when people get food poisoning, they start being sick because the body's trying to get rid of that food. So I wonder why your body would react to this, this ketamine. Intranasal ketamine. I wonder why your body would react in that way. Let's see what else it says. On the plus side, dissociation diminishes. Oh, what is all this all about? Such patients should talk to their doctor about the chances of dissociation and how it makes them feel powerless over their bodies. On the plus side, dissociation diminishes the feeling of fear and anxiety so that the patient can observe the situation objectively. It is better to feel at ease and get rid of the fear. I disagree. I mean, when it comes to hemiplegic migraines, I didn't want to be docile. I didn't want to be doped up and out of it. I wanted to be alert and aware. I wanted to have all of my attention, all of my mental faculties. I needed them because I needed to figure out how to solve this. And I weren't going to stop until I figured it out. And this list of different pills and potions that could numb it didn't do it for me. I didn't want to learn to live with it. I was never sold on that idea. And believe me, they tried to sell me on the idea that it wasn't about fixing the problem. It was about learning to live with the problem. I never accepted that. I couldn't. It wasn't in my heart. I'm pleased I wasn't able to, because now I'm able to bring this to you, show you the ridiculousness of this whole thing. I needed to be desperate for a solution, for me to try everything I could. And I tried so many things. And I tried the lion diet, and it worked. Now, had I been doped up, docile, like these people want me to be, I wouldn't have found that solution, which means I wouldn't have been able to bring this to you today and hopefully change your life and make your life better, because I know how bad it is to go through hemiplegic migraines. These types of people who run these places, they probably haven't got a clue. They've probably never experienced it. So they don't really care because they just think that you're exaggerating your symptoms anyway, which is the majority of the responses that I got. Sitting there waiting for you to stop talking so they can just rattle off a bunch of nonsense that does nothing to help. Let's have a look what else this does. So drunk feeling, dizziness, lower sense of touch, numbness, lethargy, vomiting, vertigo. Only lasts for a few days. Oh, that's, you know, only get a few days of it. That's all right then, isn't it? What is this? This is something that's used to control rapid heartbeats or abnormal heart rhythms. Oh, this can give you blurred vision. A very common symptom of hemiplegic migraine. Chest pain, discomfort, confusion, dizziness, faintness, lightheadedness when getting up, fast, slow pounding, irregular heartbeat or pulse. There's some common side effects to these drugs, aren't there? And I wonder if these are things that we should be ignoring, or whether these are things that are showing that your body doesn't really want to be experiencing this. Maybe the hemiplegic migraine as a whole is a signal from your body saying you're doing something wrong here. There's something your body is doing wrong. It's not that it's saying to you, we need some drugs, we need some chemicals, some potions that are created in a laboratory that create a bunch of side effects like chest pain. like irregular heartbeat, to fix. Maybe when you're experiencing this, it's your body telling you you're doing something that's not working for me. And you need to try to figure out how to stop that and what you need to do to fix this problem, because there is a root cause, whether these people claim there is or not. This is what Google's telling you, I know that. And it's easy to trust Google, isn't it? Because you've searched it and now you feel like, oh, I've done my research, so I know that's true. But if that's not good enough for you, if you're not willing to accept that there's nothing you can do about this, if you're not willing to accept this is your life, this is all you can experience, if you're not willing to take a bunch of drugs and experience a bunch of side effects, and you want to address the root cause, I encourage you to try the Lion Diet. Because this is the only thing that has ever worked for me. And that is what I want for you. Just give it a go. Just try it and see. If it don't work, what have you lost? Nothing. Just a load of weight, that's all. You'll just lose a load of weight and you'll get healthier. Good luck, everyone.